Imagine looking at a face, yet all you can see is an eye or maybe a nose. Or imagine feeling pressure in your stomach, but you don't know if you're hungry or you need to go to the bathroom. Imagine your hearing is so sensitive that you can't make out what other people are saying because of the overwhelming background noise. Or that your sense of touch is so sensitive that your clothes feel like sandpaper. These are just a few examples of what people on the autism spectrum may experience. Autism spectrum disorder, or ASD, is a developmental disorder that usually appears in the first 3 years of life. It affects the brain's normal development of social, emotional, and communication skills. According to the Center for Disease Control, today, 1 in 88 children will be diagnosed with having autism. The term spectrum refers to the wide range of symptoms. People with ASD can be anywhere from mildly impaired, which is called Asperger's, to severely disabled, which is the classic autism. Today I'll talk about what causes autism, some common signs, and how it is treated. So let's look at my first main point. What causes autism is quite controversial, and no one knows for sure why. The Mayo Clinic suggests it could be genetic or linked to the environment, such as viral infections, complications during childbirth, the age of the parents, or even air pollution or processed foods. Many parents believe autism is due to childhood vaccinations, especially the measles, mumps, rubella vaccine, but this theory has never been proven. Autism is found in every race, ethnic group, nation, and social standing, but boys are 5 times more likely to develop autism than girls. Now let's look at my second main point. What are the symptoms or common signs of autism? People with autism generally have problems in 3 critical areas. Social skills. He or she may have difficulty making eye contact, forming friendships, and often lacks empathy. Communication. He or she doesn't speak or has delayed speech, or doesn't appear to understand simple questions or directions. They may find it hard to start a conversation or to keep one going. Emotional and behavioral skills. He or she may perform repetitive movements such as rocking or hand flapping. They may become disturbed at the slightest change in routines and can be intensely detail-oriented. I know a man, his name's Donald. He's in his 40s and works at a sheltered workshop. One of the jobs they do at this workshop is to fold invoices, put them in envelopes, put a stamp on them, and get them ready for mailing. If someone was to put a stamp on upside down, this would cause him great anxiety. He will stomp and scream until the stamp is put on the envelope correctly. If you tried to explain to him that the post office would still deliver the mail, this makes absolutely no sense to him. He's also obsessed with birthdays and will ask anyone, even complete strangers, what their birthdays are, and it must include the year they were born. Amazingly, he can tell you what day you were born on. I was born on a Friday. And lastly, my final point. What treatments are available? Although there are treatments available, there is no cure for autism. And because of the broad range that stretches from mild to severe, there is no one-size-fits-all treatment. Autism is not a disease. They may seem to be intellectually challenged, but many are extremely bright and may have a higher IQ than normal. Studies have shown that when preschool age children with autism receive early intervention, such as speech or occupational therapy, this does seem to help. And antidepressants may be prescribed to treat anxiety, or in extreme cases, antipsychotic drugs may be used. Special diets and even acupuncture have been used as well. But for me, I don't believe people with autism need to be fixed. They're one of a kind and very special people. Did you know that many famous people are thought to be somewhere on the autism spectrum? These people include Bill Gates, Mark Zuckerberg, Steven Spielberg. Dan Aykroyd has a fascination with police and always carries a badge with him. Mark Twain, Thomas Jefferson, Albert Einstein, Isaac Newton, Bach, Beethoven, Mozart, Da Vinci, and the list goes on and on. I wonder how our lives might be today had we fixed these people. So in conclusion, nobody really knows what causes autism. People with autism usually have difficulties in three main areas: social, communication, and emotional or behavioral skills. And although there are treatments and therapies available, there is no cure. Having worked with people with autism, I am a better person because of them. They have taught me patience, understanding, and to take joy in the little things. Once you open yourself up to understanding autism, you learn to appreciate their little eccentricities. Dr. Temple Grandin, PhD, scientist, inventor, author, and the most accomplished and well-known adult with autism in the world, once wrote, "What would happen if the autism gene was eliminated from the gene pool? You would have a bunch of people standing in a cave, chatting and socializing and not getting anything done." Thank you.